I'm Jenny Veitch and I'm a researcher with the Institute of Physical Activity and Nutrition at Deakin University at the Burwood campus. More than 20 years ago I was employed as a project manager on some major research projects, and I really loved the whole process of research and the gathering of new knowledge, and so that motivated me to complete my PhD, which I completed more than 12 years ago, and I've been a researcher ever since. The objective of my research is to understand how parks can be designed to optimise opportunities for physical activity for all people. Physical inactivity is a well-established risk factor for cardiovascular disease, but currently only about 45% of adults and approximately 20% of children are sufficiently active. Parks are an important part of livable cities. They provide opportunities in a setting for all people from across all demographic groups to be physically active. However, my research has shown that parks are generally underutilised, and most people when they visit parks are engaged in low levels of physical activity, and there's very little evidence to inform park design and what would make a difference to increase visitation and physical activity. So, given population growth and high density living and our increased sedentary lifestyles and use of screens, the need for parks which provide opportunities for exposure to nature and opportunities for physical activity is more critical than ever. Projected outcomes of my research is to have high quality evidence on what park features should be prioritised to ensure that our parks are designed so that children, adolescents, adults and older adults want to visit a park and be active once they're in the park. My research has shown that very small changes to the park environment can have a very large impact on both the numbers of people visiting the park and how active they are whilst they are in the park. And so therefore there is real potential for the evidence to provide population level increases in physical activity and sustained changes which can lead to increases and improvement in cardiovascular health and heart disease. The support of the Heart Foundation has enabled me to really further develop my impactful and high quality research, which may not have been possible without the funding from the Heart Foundation, and this has benefits to not only the Heart Foundation but Australians more broadly. Gathering new research evidence is so important to continuing to fight cardiovascular disease and improve heart health for Australians, because new knowledge is constantly needed to develop new strategies and new interventions that and create new knowledge that hasn't before been known or understood. And so the more we can understand and provide evidence that can help us to not only create a better knowledge base, but also develop either it be new techniques or in a clinical setting, or whether it be more like my research, which is about understanding how we can design the environment to encourage people to be more active, which can lead to improvements in heart health. This is not possible without continued funding for research to enable researchers to progress their findings. Donor support is absolutely critical to enable researchers such as myself to conduct nationally and internationally recognised research that can be beneficial for the Heart Foundation and Australians overall. The funding landscape in Australia is very competitive, and it's very difficult for researchers to obtain funding to continue to progress and develop their research career and become independent researchers. So funding from donors is absolutely critical and really enables researchers such as myself to enable them to continue their research pathway and explore and develop the research which is so vital to improve heart health.